Yeah, well, to get to the 90% figure is quite a challenge, but there are a number of things that we know work. One thing that is perhaps particularly effective is to offer young people, male and female, vaccination at school. We know that school-based vaccination programs are, by generally speaking, much more effective in reaching a larger number of people. If you set up a program where people have to go to a pediatrician or to their family doctor or to a pharmacy, you tend to have lower rates. It's not always the case, but generally speaking, the more barriers there are, the more difficult it is to actually reach to get the vaccination, the lower the vaccination rate. So school-based programs are really the way forward, and not all countries in Europe or more widely have school-based programs yet, but that's what we should be looking towards. I think the other key thing is to make sure that health professionals, family doctors, nurses, really any health professional that parents and young people are in contact with, understand the value of HPV vaccination. We still are seeing in some countries that health professionals aren't really fully aware of the value of HPV vaccination. They're not recommending it to young people and their parents. And sometimes they're actually undermining vaccination programs by spreading false rumours about HPV vaccination. So we know that in 1 or 2 countries in Europe, family doctors are telling parents that if they vaccinate their daughters with HPV vaccination, it will make them infertile. Now, that's completely wrong. There's tons of research that shows that the HPV vaccination is completely safe. But nevertheless, these false rumours still exist. And of course, the third thing that needs to happen is that governments and health organisations in public health need to get better at communicating the value of HPV vaccinations to wider audiences, and particularly using social media, because there's a lot of false information on social media about HPV vaccination. There's a lot of bad actors out there who are spreading myths and disinformation, and that needs to be challenged. So people need access to reliable, solid evidence. Some people, of course, are very distrustful of what they're told by their government or by a pharmaceutical company. So it's also important that health organisations, charities, not-for-profits also play a role, because they often more trusted. They play a role too in communicating good information about HPV vaccination.